All right, it's time for Ask the Derm. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer all of your skin questions. Dr. Groff, let's get to it because we got a lot of good stuff, a lot of good questions from our viewers at home. This first question says, I am 35 years old and I have some stubborn fat underneath my chin. Are there any new options besides liposuction? This is from Danielle in Carmel Valley.
Yeah, the great news is for 2015, there's a lot of new treatments that are coming out for patients. And one thing that patients are really hungry for is a treatment for that fat underneath the chin.
Oh, yeah.
Typically, liposculpture has been the gold standard, and it does work really well. But there's a new treatment coming out probably in the spring where we can inject a medication into that fat and it actually breaks it apart.
Wow.
It's amazing. Now, the downside to it is that you might have to come back to the office a few times to get the result you're looking for. But it is amazing that with a tiny, tiny needle, we can put this medication in that area and it breaks it apart.
And is that like an example of what it would be before and after?
Yes.
Okay, that's amazing. But it's not out quite yet.
No, it's going to be probably in the spring when it gets its FDA approval.
That's a few more months.
Yeah,
few more
not
months.
Too bad.
Okay, let's move on to this next question. This question says, I used to have thick, luxurious hair like Raul. But that is long gone. That's in the question. Now the top of my scalp is severely sun damaged and it looks terrible. What do you recommend to help this look better? This is from Reginald in Point Loma. Oh, okay. What is this?
Well, there's no doubt that Raul does have amazing hair. So, he doesn't have to worry about this sort of thing. But when guys start to lose their hair in their 20s and 30s, by the time they're in their 40s and 50s, it has a lot of sun damage.
Yes.
So what we can do is there's a laser called the Fraxel. And what the Fraxel will do is it will draw all the pigment and sun damage out of the skin, but it also takes care of the precancers that are in the skin. So you get a cosmetic benefit as well as the benefit for the precancers.
Okay, and do you have to do that one time, multiple times?
That was one treatment, yes.
Treatment.
One treatment will clear probably 70–80% at least of the spots.
Okay, let's get to the next question. It says, I just turned 64 years young. My hands are driving me crazy because they look so bony and thin. What can I do to change this? This is from Sally in Cardiff.
Yeah, the funny thing about, that looks really good.
Wow, this is a before and after?
Yeah, this is a patient that I injected a product called Radiesse in her hands. And we've been doing this now for a while, but it's actually looking like it's going to get an FDA approval, which patients always like that stamp or that certification that the FDA has found it to be safe. But it is safe, and we've been doing it for a while. And what you can see is that it fills in all the little gaps.
Right.
And it kind of covers with the tendons and hides those kind of bulging veins. So it's a really nice cosmetic treatment there's no downtime. You come in, it takes a few minutes to do, and you go back to your lifestyle.
Like just one time you would get results? You got to do it multiple times?
One time. One time is enough for most patients.
I love it. Does it hurt?
We put a little numbing cream on the skin. You barely feel it.
You barely feel it, like a little mosquito bite or something.
Right. That's right.
Okay, here is the final question, Dr. Groff. This one says, I was a big-time sun worshiper in my teens and through my 30s, and I have all of those raised brown spots on my legs. What are they, and how can I get rid of them? And that's from Nancy in Coronado.
Well, Shelly, you might remember a few months ago we talked about a new laser that's used for tattoos called the Picosure. And it's kind of really revolutionized the way we treat tattoos because it cuts the treatment times in half and the number of treatments required. Now, this same laser we found to be very effective for sun damage, particularly on the legs. So when men get into their 40s and 50s, they start getting these raised brown spots on their legs. They're called seborrheic keratoses. They don't look very nice, and they're typically very difficult to get rid of, but this Picosure laser is able to put enough energy into the skin and break those brown spots apart, and they just peel off the skin really nicely, and you get a nice cosmetic result.
Does that hurt?
It feels like a little bit like a rubber band snap on the leg.
I love
Very
that.
tolerable.
I ask that a lot. Does that hurt? I want to know the pain involved in it.
Gotta toughen you up a little bit.
I don't know about that. Dr. Groff, thank you for being here. If you want to get in touch with him, learn about more of those procedures that we just talked about, go to fox5sandiego.com, click the C.